October 15th marks the start of the Medicare annual enrollment period. Now, with the national inflation rate at all-time highs, it is more important than ever for older adults to make Medicare decisions in a cost-effective way. So joining us to discuss the annual enrollment period and what you need to know is Mr. Bob O'Connor, Vice President at Aetna Medicare, a CVS health company. Thanks so much for waking up with us.
Hey, Maggie, let's talk about Medicare today.
Yeah, let's spice it up a little bit. I mean, we have to celebrate, right? And celebrate saving money. So thank you so much for joining us. What would you say should seniors be thinking about before enrolling in a Medicare plan?
Yeah, so I get that question a lot, Maggie, and we always tell people they should look at what they're paying right now in terms of premium and what their copays might be. Tell them to make sure that they're taking a look at the plans, drug program, understanding what those copays are, making sure they understand what's on the drug list. And that changes every single year for most companies. In fact, at Aetna, we actually took nearly 300 medications and dropped the copays drastically on them. Went from like $45 or even $100 down to zero or just a couple of dollars. And so, big savings for people on those medications because, nearly 80% of seniors are on 2 or more medications. And so it can be a big savings. And then checking the network, making sure your doctor, your hospitals in the network, and also those supplemental benefits. That's oftentimes where people can really make a savings on their monthly budget that, helps take that bite out of inflation.
And given the current state of the economy, I mean, I know that everyone's worried about it, especially if you have a fixed income. So how can seniors make sure they're getting the most value out of their plans?
So I think it's, researching the different plans that are available in the area and finding one that matches up with things that you might already be spending in your monthly budget. And so, one of those items is fitness. Maybe you belong to a local gym, and you could take that monthly payment, and that might actually be covered by your health plan through the Silver Sneakers program if that fitness center is actually in the network. A lot of dental coverage. And so, for example, these programs not only just cover things like cavities, or fillings or x-rays or cleanings, but also things like root canals or crowns and even implants. And so getting the details into exactly, what that program covers and what your needs might be the next year, I think is really key. Some programs cover eyewear, some of them cover hearing aids, all sorts of different programs that are available.
And do you have any other benefits available that can help people save some money?
We do. So one of them is over-the-counter coverage, and so coverage for medications, things like vitamins, minerals, even things like Band-Aids, right? And it all adds up, and so you can order those things out of a catalog or go into a local CVS, pick them up off the shelf in accordance to a quarterly allowance. And probably the neatest thing is we've started to add coverage for things like utilities and healthy foods. We all know how energy costs go up, and so we've got programs that will cover a portion of your electrical bill or even your internet. And we all know how inflation has impacted us at the grocery store, and so a lot of our programs offer a healthy food card. It's a card you go in your local grocery store, helps you pay for healthy fruits and vegetables, meats, and even pantry staples. And so again, taking items that people are paying for right now and having them covered as your health plan, because these are all items that contribute to people's health.
Geez, I had no idea all of this could be covered. Thank you so much for sharing all of this. Where can people go for more?
Thank you. Lots of good information. We do recommend that people talk to a local agent. There's lots of good local agents who are experts on healthcare right in your neighborhood, but also lots of good resources online. So you can go to the federal government site, which is medicare.gov. And we also ask people to check us out online, not only information about our plans, but also other resources and education people find useful at aetnamedicare.com.
Well, it's been a pleasure having you, and don't forget to get a taco today. Thanks so much for waking up with us.
Thanks so much.